What should you know in the first trimester of pregnancy? Frequently asked questions and biggest health tips. I'm Dr. Natalie Crawford. I'm an OBGYN and a fertility specialist, and I am an expert on helping you get pregnant and in the first trimester of pregnancy. And frequently, my patients are so focused on getting pregnant that we're really unprepared for what to do and what is normal and what is not normal once you're pregnant. So I'm going to dive in and answer some questions that I get asked all the time about early pregnancy in the first trimester. If you're a fan of learning more about your body and your health, please subscribe to our channel. This is how we help spread more health information and empower more people to understand their bodies and advocate for themselves. All right, first is what happens in the first trimester. The first trimester, your embryo implants at the blastocyst stage, which is about 5 or 6 days of development. It is a ball of cells, about 300 cells, and then it starts to invade into the walls of the uterus. The embryo then goes from that 300 to 500 cells into a fetus, which is about the size of a lemon. At that stage, all your major organs are developing over the course of the first trimester. So the first trimester typically is considered to go up to about 14 weeks. All your major organ systems are developing, and there's extreme focus on the brain and the spinal cord, the neurological system during this time period. And that is why the things that you do in this first trimester really are very important for the health of your baby. Now, how much weight should you gain? A very top question that I get asked all the time. Now, over the course of your entire pregnancy, you should gain about 15 to 30 pounds, depending on if you're overweight or underweight. However, most of that weight happens in the second and third trimester. In the first trimester, usually you'll only gain up to about 5 pounds. I will give a huge disclaimer that if you've undergone IVF or fertility treatments, you might gain more weight, and that is okay. That might be because of the progesterone or the other hormones we had you on. It'll even out in the end. But do not feel like you have to start putting on tons of weight right away. That's actually not required at all. Now, next is it normal to have cramping? As I said, when that embryo arrives in the uterus, it actually starts to eat away at the uterine wall so that the placenta can grow in. And that process is actually painful. I was shocked when I was pregnant. I was convinced that I was miscarrying because I had pain, and I was so surprised by the intensity of that pain. And my doctor told me, yes, I wasn't OB/GYN at the time, but my doctor told me, Natalie, the embryo is growing away, eating away at the walls of the blood vessels in the uterus so that you can make this blood connection. Of course, it hurts. So cramping can be totally normal. Now, this pain should not be doubling over. It should not be severe. Stabbing should not be associated with loss of consciousness or passing out. And those could be signs, especially if you've not had an ultrasound yet, that the pregnancy could be in the wrong spot, and you might need to consider, is it an ectopic pregnancy or something going on? So one-sided severe pain associated with passing out, loss of consciousness, or doubling over, you should seek medical care. What about spotting? So if you have intense pain associated with bleeding, you should seek medical care. So cramping plus bleeding may not be good, although we do see some spotting with the same process as the placenta is growing in. One of the top causes can be a subchorionic hematoma, and I have a whole video on SCH where you can learn more about it. When you have an SCH, this is a little pocket of blood that develops behind the placenta that typically resolves over time, but we do typically ask patients to be on pelvic rest, meaning no vigorous exercise, no intercourse, nothing in the vagina until that area has healed all the way up, which is usually when the placenta is fully grown in. Your most common symptoms in the first trimester. So in the first trimester, it is very common to have extreme fatigue. I used to fall asleep at my desk as a fellow. Extreme profound fatigue, nausea and vomiting, and breast tenderness. Those are probably the 3 biggest symptoms that we can see. We also can have cramping, bloating. Sometimes you do get some of that spotting, and increased sensitivity to smell is a commonly reported symptom as well of early pregnancy. Most of these do go away once the placenta takes over and you get into the second trimester. So typically these are all more intense in the early part of the first trimester. What can you do if you do have some of these? So make sure you're giving your body rest, stay hydrated, and if you do have nausea and vomiting, I recommend small frequent meals, Your stomach is worse when it is empty. So whether that's crackers or something small next to your bed, making sure you're balancing some carbs plus protein. Personally, I used to love chocolate almond milk, like a tiny cup of it very, very cold would give me some protein early in the morning and something in my stomach. So when your stomach is empty, it's a little bit worse. Also, ginger can sometimes help, whether it's a tea or a candy or something you can suck on. And other people really benefit from some things that could be sour. So I will sometimes tell patients like Jolly Ranchers can be a good thing you can suck on that can sometimes help. We don't want you to be suffering. So even though we're really cautious about what medications we give you when you're pregnant, we do not want you just suffering in pain. So make sure you're talking to your doctor to see if you need to be on extra vitamin B6, if there is any antiemetic or anti-vomiting medication we can put you on. So don't just suffer. If you are keeping no food down because you're vomiting, not just nauseous, but actually vomiting, sometimes you have to be admitted to the hospital to manage this. So if you're profoundly losing weight or you are not able to keep anything down, let your doctor know, schedule an appointment. As far as other medications go, you will see us limit what medications you should take in pregnancy, and especially during the first trimester when all of these organs are developing. When it comes to pain medications, there's been recent controversy, but we still say Tylenol is the safest pain medication. We do not want you taking any anti-inflammatory medication like Advil, Motrin, Aleve. All of those you should be avoiding. You may be on an aspirin or a baby aspirin based on your reproductive risk. That can be used to reduce the risk of preeclampsia if you're high risk, or potentially reduce the chance of miscarriage if you have a clotting disorder or a recurrent miscarriage. But that should be something your doctor knows and tells you to be on, not that you are just taking. We also do want you to be taking a prenatal vitamin with 400 micrograms of folic acid. There is the folic acid versus methylfolate debate. The truth is, folic acid in its folic acid form is the only thing that has been associated with a decrease of neural tube defects. Again, the neurological system is developing during this time, including brain and spinal cord. Neural tube defect is failure of full closure and protection of the neurological system. Now, can methylfolate be better for some people who can't metabolize folic acid? For general well-being, yes. Might it help some people if they're trying to conceive? Potentially, but I usually put patients on both because there has never been a study showing that methylated folate is as protective as folic acid. And there probably won't be, because you're not going to take somebody and run the risk of them potentially getting a birth defect by giving them substandard care. Folic acid is now the standard of care. So if your prenatal vitamin only has methylated folate in it, you need to know that that has not been shown to reduce birth defects like folic acid has. And I usually recommend my patients take folic acid. I also like prenatal vitamins that have some omega-3 fatty acids in them, like DHA or EPA. These can be very helpful for that early brain development. A lot of prenatals are supplemented. If not, you can find a separate fish oil or omega-3 fatty acid. If you're not a fish person, they do make some that are non-fish based. That's okay too. Other things to know about is it safe to have sex or to exercise? And overall, yes. If you've gone through fertility treatments, I usually do tell you not to have intercourse until we have seen that heartbeat. Not because there's any association with intercourse and miscarriage, there's not, but because I know that you're going through so much, it makes us feel more empowered that we didn't do anything wrong along the process. But overall, babies happen and implantations happen all the time while you're having intercourse, and so that is totally fine. Exercise, we usually do not like you to start a brand new exercise program, but maintaining the exercise that you previously had is fine, with the exception, no hot yoga. We don't want your body temperature rising really, really high. We also don't want any activities, especially as you're exiting the first trimester, that could potentially pose uterine trauma. So downhill skiing or horseback riding. In the early first trimester, the uterus is protected by the pelvis, so it's not as important, but we are going to want you to do non-traumatic exercise. We want to make sure that you know your blood volume is going to be changing. So I don't love people not listening to their body and being so stuck on a program. So listen to your body. You might have to take more breaks. You might have to take the intensity down. But we have people who are professional athletes who are pregnant and still practice their sport. So listen to your body is key. Exception, if you've gone through fertility treatments and you could have big ovaries, we do not want you to get ovarian torsion, which is a twisting of your ovary on its blood vessels. And so you might hear us restrict your activities if you are a torsion risk. So essentially nothing that would cause your ovaries to bounce in your body. So make sure that if you're undergoing fertility treatments, you do listen to your doctor's recommendations. And overall, for food or other toxins and exposures, certainly we want you to avoid toxins. So, no cigarette smoke, no alcohol. Those are both not good for you or for the baby. We also recommend pregnant women avoid changing litter boxes because there is a birth defect causing disease called toxoplasmosis that you can get from cat poops in the litter box. So somebody else gets that job now. If it has to be you, wear gloves. And then when it comes to food, for the most part, eat what you want, but we want to make sure you are not eating any raw or undercooked meat, any unpasteurized milks or cheeses, and we do want to limit your exposure to mercury. So that usually comes from fish, especially those bigger fish, but the fish recommendation is less than 3 servings per week is going to keep you in a safe zone. Other foods, just titrate. It's fine to have a very bland diet if you're really nauseous. It's fine to limit your foods. That is one of the body's defense mechanisms to avoid you being exposed to some of these bad things. As your pregnancy progresses, certainly we want you to have a diet really full in fruits and vegetables with lots of diverse nutrition. But if in the first trimester all you want to eat is bread, that's okay too. So listen to your body, take in the calories you can, don't get stressed out. Avoid food that could have contaminants, avoid toxins. But overall, no, things will change after the first trimester and you will start to feel better. Big warning is that you are more prone to heartburn because of the high progesterone. Your stomach, the sphincter of your stomach is more relaxed and doesn't keep the stomach acid in it as well. So be careful if you eat hot or spicy foods, as that may irritate and make you even more prone to heartburn. And you may need to be taking an antacid. Talk to your doctor. All right, well, I hope you enjoyed this video with health tips to early pregnancy and just some basics, do's and don'ts, and things to know. As always, you can follow along on Instagram at Natalie Crawford MD or find out more on the As Woman podcast. Thanks, friends.